In May, the CDC put out new guidance telling the fully vaccinated that they no longer needed to wear masks outdoors or indoors in all but the most crowded settings. The decision came as the more contagious and dangerous Delta variant was starting to spread in the U.S., and it left many confused, including those who rightly pointed out there was little stopping those who aren't vaccinated from taking off their masks in public, too. Now, just 2 months later, Delta is responsible for the vast majority of all COVID cases in the U.S., including a growing number among the fully vaccinated. And after saying just last week that they had no plans to change their minds unless there was a major change in the science, the CDC is doing just that. The agency updated its guidelines today to recommend everyone, vaccinated or not, wear masks indoors in places where the virus is spreading widely. And some are taking more decisive action than others.
Now, these numbers are extraordinary. We are seeing nearly 1,000 new cases in Orange County daily. Those are the numbers we saw at the highest peak last year.
Given our current situation and based on the advice of these esteemed medical professionals behind me, I have ordered the reinstatement of Savannah's mask mandate effective immediately.
Some areas and organizations are also considering vaccine mandates, too, including New York City, which is expected to require all city workers get the shot. And yesterday, the Department of Veterans Affairs officially became the first federal agency to do the same. Of course, all that pales in comparison to the mandate France's legislature just passed, which requires proof of vaccination for all restaurants and domestic travel. Despite resistance, the move has already had some early success after France's president previewed it earlier this month. More than 1 million people made vaccine appointments in less than a day. And it begs the question, should we be taking a page out of their pandemic playbook? I'm joined now by Dr. Sabrina Assoumou, infectious disease physician at Boston Medical Center and an assistant professor of medicine at BU, and Dr. Nancy Krieger, a professor of social epidemiology at Harvard's Chan School of Public Health. Welcome to both of you. Thank you for joining me. Dr. Sabrina, I want to start with you, and I want to end the interview at the beginning and ask you first what I would ask you at the end, which is, here in Massachusetts, with our high vaccination rates, should all of us be wearing masks in the way that we were before May?
I think that what the CDC is trying to do is that the protocol that you recommend for a place that has high vaccination rate and low case rate, high vaccination proportion and low case rate will be very different than what you would recommend for a place that has low vaccination rate and high case rate. So in terms of what we need to do in Massachusetts, Dr. Walensky was very clear in her press conference. She said, you have to look at the county level. What is your rate of infection? And if you are greater than 50 cases per 100,000, then you should definitely reimpose those mandates for indoors.
Dr. Nancy, I always get concerned about this because I feel like we need to correct sometimes in order just to get people to do the basic stuff. So giving people a mixed message and asking them to go seek out information in order to make a decision that's best for them and their family seems like a heavy lift. Am I wrong on that?
I think what's really important is that we live in a society, and that means that there are rules that need to happen across the society to help keep people safe and to understand that it's not a matter of just personal responsibility, because not everyone has equal access to conditions that enable them to get vaccinated, to also to have the questions about what kinds of work situations they're in. To assume that this is all voluntary recreational behavior and recreational mask wearing isn't correct. So the question is, what's needed for people who are at work in indoor settings to be safe, which is a lot of where public interaction takes place. People who are indoors in settings where they're there for quite a while need to be able to have something at their back to help support wearing of masks when we have a much more transmissible virus. I mean, Delta is way, way, way more transmissible. I think the other thing that's really critical to emphasize is not simply the case numbers with regard to why to get vaccinated, but that if you are vaccinated, you are very unlikely to get so sick as to die. That's the crucial distinction. It's not that you won't get sick. And I think the question of clear messaging has to be that the purpose of vaccination is twofold. It's to prevent you from the risk of getting so sick that you die. And also it's to prevent that risk for other people, for people that you love in your family, around the healthcare workers, and many others. But it also has to be framed in terms of what is needed as clear messaging to keep people safe in the many different public contexts when you don't know who the other people are. That's very different than a private event in your own home. That's very different than walking in a park in outdoor air, which is not crowded. It's about really thinking that this is a virus that is respiratory. It goes from the air, from one person to another. What's the context in which people are connecting? How closely? How much are they gathered? How good is the airflow? These are the questions that matter. And they matter, and they're socially structured. Who has safe workplaces? Who has been given paid time off or not to get vaccinated? Who has been given paid time off or not when they have sick leave? These are the things that really need to be looked at for social response as well, not just simply vaccine or mask, but who again is enabling the policies and the resources to make sure people can be vaccinated and to make sure that they can wear a mask knowing that their employer has their back.
Dr. Sabrina Assoumou, I want to talk a little bit about what would it take if you're vaccinated, you've been fully vaccinated, you're with your family in your bubble, you're traveling to a wedding, you're in the car with folks. I keep hearing mixed messages about what it would take to get infected by this Delta variant. Can you like map out a scenario for me about how much close contact would I have to have with somebody who's infected in order for me to get infected?
Yeah, I know this is, we're still trying to determine in terms of like what the dynamics of this virus are actually. But one important data that just came out, and this is what motivated the CDC's change in guidance, is that when you compared the viral, so how much virus was detected, and a person who's vaccinated and someone who's not vaccinated, they have very similar level of virus. And so this is why the CDC was motivated to say that your vaccination status shouldn't determine whether or not you should get masked indoors, and that you were more likely, you could also transmit as well. In terms of thinking about scenarios, I always think, you need to it's been a long year and a half, and we all need to think about what are the alternatives. And what I encourage people to do is, if you're gonna have a gathering, have it outside. Outdoors is safe. You don't need to be masked outside, just be outdoors for any activities with family and friends. In terms of being indoors, that's when you have to think about what is your own personal history. Do you have an underlying condition that put you at risk for severe COVID? Do you have children who are unvaccinated? You have to think about your environment, because in those cases, especially with what the CDC is saying and what we know about the Delta variant, is that when you're indoors, especially in a place where you don't know people's vaccination status, you should wear a mask.
Dr. Sabrina Assoumou, the other thing Rochelle Walensky said, the director of the CDC, is she had concerns about the spread of the variant that might make worse variants down the line for us that may be resistant to vaccines, and that when we're thinking about our interactions, it's not just about, well, we might get sick and be mildly sick, or we might get infected and be asymptomatic, that we're safe if we're vaccinated for the most part, for the vast majority of it, from being very ill or being in the hospital. But it does require us to have some critical thinking about what this virus will do and what its goal to do is and what we're fighting, right?
Yeah, no, this is an essential point. This is why, whenever I give these talks or I'm asked questions, I'm said, we don't live in a bubble. None of us are safe until all of us are safe. That is why if there's variants replicating anywhere, not just in the US, but in any place in the world, if we in the US don't work very hard to make sure that everyone has access to vaccines and get vaccinated so that we don't have new variants that will come along and evade immunity, then we're going to be in trouble. And so that is why it is not only important for us to get vaccinated in the US, but for us to make sure that we get everyone vaccinated so that, at this point with Delta variant, this is a message that I also try to sort of express very clearly, is that we got very lucky. Our vaccines, all the vaccines that have been currently authorized in the US, Moderna, Pfizer, J&J, they all work for the Delta variant. And that is a message that we need to get out. But we got lucky. we may not get so lucky with the next one. And so that is why it is so critical to get as many people vaccinated in Boston, in Massachusetts, in the US, and around the world.
Dr. Nancy Krieger, I was looking at the vaccination rates today and engaging with some folks on social media nationally, the vaccination rates nationally. And, it's looking like, 50% of Americans have had both vaccines, 60% have had, one. And then the conversation comes to your point earlier, there's probably 20% of Americans who want to be vaccinated or are about to be vaccinated but are having difficulties getting the vaccine for the issues you brought up. And then there's this 20% that just may never decide that they will agree to get vaccinated. Should we be pivoting our attention or putting our attention on getting the vaccine, delivering the vaccine to people who want it but can't get it?
I think it's really critical in every single state and within states, because states play a huge role in setting terms here, to get people who need the vaccine and want the vaccine but are unable to get it because they don't have the work conditions that make it easy, time off work, paid sick leave, for them to be able and have physical access to getting the vaccines, the local area work. That's absolutely crucial. People who are resistant to getting vaccinated, there are very different reasons. There are some people who have very deep personal convictions. That's going to be a different conversation. There are people that have fears that have been fostered by people that have been spreading misinformation. Whether or not those people can be reached through different kinds of messaging, if it's about getting across clearly that there have been millions upon millions upon millions of people vaccinated with very few adverse outcomes in this country and many deaths averted, that message has to be able to be conveyed clearly. If people are worried about questions about control, people can have control of what goes in their bodies in terms of the vaccine, but there are many things that are very damaging to people's health that they don't have direct control over. Whether you want to call that air pollution, whether you want to call that other kinds of additives that are in many things that people ingest anyway. But the vaccine becomes this focus that's not just about the vaccine. It's about, do you have control over what does or doesn't go in your body? And I think figuring out ways to engage with those kinds of conversations is really important. But first and foremost, I do think making sure that people that want the vaccine and are unable to get it, get that vaccine while other conversations are going on to address the misconceptions and the deliberately fomented lies about the vaccine is really important.
Dr. Assoumou, as we wrap up here, I just want to give you the opportunity to remind people that if they have regular checkups that they should be having and their kids should be going back to school, it's time to try and get those appointments and get back on the beam of seeing your doctor on a regular basis, right?
Absolutely, absolutely. I was just, in clinic recently, and you wouldn't believe, a lot of people, felt either that it wasn't safe to come back to the clinic or the hospital for regular checkups. So it is so critical that we make sure that we encourage not only vaccinations, but all the cancer screenings. I can tell you that I've never been on service when I've seen so many stage 4 cancers. Just in a 2-week period, because there was a lot of delay in care. So yes, absolutely. And make sure you connect with your doctors to get your health care.
And mental health, as we're going to talk about Simone Biles in just a moment, but folks, I imagine they're weary, so they need to make sure they reach out for help.
Absolutely.
All right, I thank you both, Dr. Sabrina Assoumou and Dr. Nancy Krieger. Thank you for joining me. I appreciate your input and expertise.
Thank you.
Thank you.